Okay, we're going to be covering the healthcare delivery system, which is chapter 4 in your book. Here are your objectives: compare and contrast, explain, identify, describe, explain again. And you need to be able to give details, list, describe, and define all of these different objectives. Very important that you're able to understand what the objectives are, and if you can answer them, you're going to do very well in your quiz. These are the key terms. Be able to identify these key terms. I may have them multiple choice, or you'll have to be able to define them. So these are really good flashcards. All right, today's healthcare delivery system. Now, it's evolved a lot over the last few years and with the ACA, and I'm not sure where it's going to go moving forward in the next 5-10 years. So looking here, it started off as a fee-for-service where the doctors used to go in and they'd make home visits and they'd come see their clients if they were sick. It wasn't normal for someone to go to the hospital unless they're really critically ill. So as time progressed, we went into an HMO system. It's a health maintenance organization. So typically you'd be seen by a PA, a nurse, a practitioner. You didn't necessarily get a doctor all the time. That has evolved where you're more inclined to get a doctor. So we have managed care systems and PPOs, which is preferred provider organizations. There's also federal health insurance where the ACA is located, also Medicare and Medicaid. So those are the government run, and it provides a lot for patients that are disabled permanently, that are senior citizens, and people who just can't afford insurance where their work doesn't provide insurance. So our tax dollars pay for that, and it's very, very, very expensive. All right, so the different healthcare facilities. We have hospitals and outpatient centers. So hospitals can be private, they can be public, they can be not-for-profit or proprietary. So the proprietary means that it's for profit. So they're there to make money. Usually you don't see a lot of for-profit hospitals. They tend to get into trouble for self-referring. So there's been a lot of laws that have been passed where they can't self-refer. A lot of physicians got in trouble. So they're not allowed to refer to themselves, patients. So if a orthopedic surgeon owns an MRI, it's now a problem if they refer to themselves for the MRI to get done. So it's a real gray area and one that they typically like to stay away from. So outpatient centers, there's urgent care centers and there's surgery centers. There's also radiography offices, all kinds of different outpatient centers. So there's just a couple examples. And the healthcare team. So as you can see, there's a lot of people that have to work together in order to treat patients. So these are the common specialties. So there's the ER physician, there's a family practice physician, which is very different than the ER physician. Gastroenterologist specializes in the GI system. Geriatrician, there's a gynecologist, an ophthalmologist, oncologist, obstetrician, intensivist, a hospitalist. There's so many different types of specialties. If you can think of an organ system, there is a specialist for that. And then as you can see off to the side, there are radiologists, and that's who we work for. Hospital organizations and management. So within the hospital, you have your executive board. The executive board hires the CEO. So the CEO runs the daily business, and the executive board appoints and approves staff. So they rule the roost. They are the top people. They hire and fire the CEO. Under them, under the CEO is the administration. So the CEO can be part of the administration, the CFO, all the managers, supervisors, and directors can be part of the administration. And then you have departments. So there's diagnostic therapeutic support in general. In each department will have directors and managers and supervisors within them. So if we look at the direct patient services, there's general, diagnostic, therapeutic, and supportive. Under general, it's like your admissions, ER, nursing, social services, your chaplain. Under diagnostic, that's us. So we have CT, there's the ECG and EEG, there's MRI, nukes, nuclear medicine, pathology, radiology, sonography. So as you can see, a lot of it is radiology, which is very cool. Therapeutic, you have dietary, occupational therapy, oncology, physical therapy, respiratory therapy, and surgery, and your support services. Now, just so you know, we can't survive without our support services, so make sure you're extra nice to them. And that's our accounting, our central supply, human resources, housekeeping, laundry, medical records, purchasing, and security. Make sure if you're in a hospital setting that you say hi and you help the housekeepers and you help the people with the laundry. Be very, very kind to them. They have a very hard job and people tend to ignore them. And that's something I look for when I'm hiring. I'll walk by housekeeping and see if they acknowledge. It's a big deal. All right, so services and roles within the imaging department. The radiologist is our physician, and they hold the license and to have us work under them. So we carry a license also, but they carry the ultimate license to have that radiology equipment within the facility. So we work for them. So there's the radiologist as the top, and then you have usually a radiology manager or a director, someone that works at supervising all the technologists and is a liaison for the radiologist. You have your chief radiographer. We also call them the coordinator or the lead. It depends on where you're at and the language in which they use. We have staff radiographers. That's all the people that are going to be training you, that are going to be working with you daily. And then the support staff, and that's everyone who keeps it running. So from the schedulers to housekeeping to the laundry to essential supply, we rely on them in order to get our patients done. All right, so our profession. Looking at our professionalism, so hallmarks, knowledge passed down from master to student. So that's how you are taught. You're taught one-on-one directly with someone in the field who's considered a master. So we have a commitment to truth and doing the highest good. So the highest good is for our patients and our facilities. So a profession is organized to govern itself. So our field, we are licensed. Therefore, we have the ARRT, which oversees us. So they hold the certification for us to work. So our licensure, it's our licensing body. We also have the ASRT. And the ASRT is our society. So the ASRT and the ARRT work together to ensure that we can get all of our CEUs, and they set the standards in our profession. So if we look at it, so the ARRT rules the roost. They hold our license. So they set the standard of professional behavior, education, and qualifications to practice. So the 2 years that we're going to spend training, or the 1 year that we're going to spend training, whatever it is, they set that standard on how we are to teach you and what we are to teach you. They enforce those standards within its ranks. It's peer-reviewed journals or publications also expected of a profession. So there's peer review journals that are going to come out from the ASRT for you to read about what's new and great in research and what's going on within radiology, which is very, very cool. And it allows the profession to advance, to review and challenge continuously. So you should read those articles and do your CEUs through the ASRT. They have the most knowledge for what we're doing in today's world. All right, professional organizations. So I talked about the ASRT. The ARRT is our accrediting body. ARRT is the accrediting body. Now the ASRT, American Society of Radiologic Technologists, is our society. ASRT, S Society. So they're the oldest and largest national professional association of imaging sciences. They've evolved over the years. They are the strongest, and they do the most for us technologists. So you'll become members, and when you're members of the ASRT, I recommend you stay members because they'll provide all of your continuing education units that are required. The 24, you're going to be required to do 24 over 2 years. As long as you're licensed. So they will provide all those units for you, and it's for a reasonable price. So I highly recommend you stay members. I've been members since I've been in school, so I'm going on 22 years now. I've been a member of the ASRT. All right, so there's also the ASRRT, International Society of Radiographers and Rad Techs. This is the International Society. So if you go to any conferences, you will see students that come from international. It's pretty cool, pretty cool. All right, so professional organizations, there's all kinds. There's AHRA, ACERT, which I'm a member of, so it's the Association of Collegiate Educators and Rad Tech. They put on a really good conference every year that's really good for students. There's AIRS, which is also Association of Educators in Imaging and Radiologic Science. They also put on a good conference for students, so highly recommend you guys try to get to a conference. So there's ultrasound and nuclear medicine and vascular interventional societies also that are real strong. So our practice standards. ASRT has our practice standards. So it's a written statement that describes the radiographer's duties and responsibilities. So it outlines what we're supposed to be doing and what we're supposed to be doing for patients. So it's our duty. And we'll go over those. We'll go deeper into them as we proceed through the program. They define the clinical practice, technical activities, and professional responsibilities of imaging and therapeutic professionals. So make sure you're familiar with your practice standards. Usually if a patient is injured, it's due to a failure in your practice standards, and I'm an expert witness for legal cases that come through, and I can tell you, I can just pull the practice standards and I can tell them you breached number 4 and you failed that patient on number 4, and therefore you are being sued for a breach of your practice standards. Not good. So make sure you stay up to date with those. Okay, so different educational programs. There's hospital-based programs, and they're typically a certificate. Now, those are going by the wayside. We don't see hospital-based programs so much anymore. So most of the time, they're community colleges or universities that are providing the education. The hospitals are getting too busy to be able to train students. So back when there was a huge shortage of technologists, they used to train them on the job. And with JRCERT, which you're going to learn about here in just a minute, it made it really, really difficult for them to hold up to the standards. So community colleges, you get an associate's degree. Sometimes if you already have an associate's degree or a bachelor's degree, they'll give you just a certificate, which is fine. You can sit for your ART with your certificate because you don't need another associate's degree. So we provide an associate's degree and a certificate. All right, so there's universities also where they can do an associate's or a bachelor's, and usually eligible for advanced postgraduate degree. So you can get a master's in radiography if you're interested. All right, so your credentials. It's a document that attests to the qualifications of an individual. So we have licenses, there's registrations, there's certifications. So I carry my license in radiography. I'm also certified as a PA. I'm also certified in MRI, CT, mammo, all different kinds of licenses and certifications. The ARRT establishes the minimum standards for certification in various imaging specialties and radiation therapy. It conducts qualifying examinations that entitles participants to pass the exam to use the designation registered technologist. So in their association with their name. So when you graduate, if you're graduating from X-ray school and you take the ART and you pass, you get RT after your name. If you're doing it for MRI, you're going to get MRI, or actually MR after your name. So that shows that you are ART licensed. You have your certification. All right, so continuing education. So currently, we have to do CEUs, and they're continuing education units, and what they are is you reading about what's going on in the field. So you are up to date. the ART and the practice standards do not tolerate someone who is not current in the field. So if you're being sued because something has changed in the field and you aren't aware of it, you will be sued. So they find that to be negligent. So they require you to do 24 units every 2 years in your area of specialty. So if your area of specialty is MRI, then you do MRI. If your area of specialty is mammo, you do mammo. X-ray, you do X-ray. So the state of California also jumps in and says, okay, you have to have a state license in radiography. Well, you're going to have to do, within radiography for your CEUs, you have to do 6 units of digital. You have to do 15 units of mammo if you carry your mammo license. You have to do like 6 units of fluoroscopy. So the units are very specific for a state license. So those of you going for just MRI only, you don't have to do that. You only have to do MRI. So if you, and you only are nationally licensed, where those of us that have RT also, it's a big juggling act to make sure that we get all of our units in the specified area. All right, so if you do not do your continuing education units, you will lose your license. So you don't want to lose your license because then you have to go through a program and then for 2 years, and then you have to sit for your exam again. So I recommend, even if you're not working in the field, to continue with your CEUs. You don't want to lose your license. I know a few people that have, and it's not pretty. It's not pretty. So looking here for the employment outlook. So what's happening is since the market has gotten better, a lot of the baby boomers are looking at retiring. So there is a huge surplus of openings due to all of these RTs that are going to be retiring. So the job market looks really good. And I just saw a survey not too long ago that shows that the technologists going into management are going to be the youngest we've ever seen, because there's going to be such a shortage, which is great for you guys. So they're finding that they anticipate that they'll have people with 5 years of experience in director roles. So keep going to school if you only have your associates, and get your bachelor's degree, get your master's degree, get your doctorate if you choose. You can do all kinds of things. Which leads me into the career ladder. So you have you can go from a technologist to a lead tech, which is great, and you can go into be a manager in radiology or a director. Now you typically have to have a bachelor's degree in order to do that. And if you're going to go even higher, you're going to need your master's degree. If you want to jump over to the education side, like I did and others that work for us, so we decided after 20 years in the field that we jump into teaching. It requires a master's degree to be you need a master's degree to be a program director. You need a bachelor's degree to be a clinical coordinator. Now you have to have at least an associate's degree with many years of experience in order to work for the college. So to be able to teach under JRCERT. Now you can go from program director to dean or chief academic officer. So there's a couple different routes that you can take, and you can just keep going. All right, so there's also commercial jobs. This is going into device sales typically. You can go into equipment or applications also, where you are working in the cath lab, or you're selling orthopedic screws or prosthetics, or like my daughter does, she does applications for cardiac devices, and she's not a tech, she just got her bachelor's in that, in biochem, and went to a specialty school to learn how to do it. Well, you guys can do it with your X-ray license and a bachelor's degree. So it's a completely different world. It's sales. It's working in the OR typically. So it's a suit type job. All right, accreditations. So there's a lot of different accreditations that you guys are going to have to be aware of, a few of them. One is it's now called the Joint Commission, or they just call it Joint Commission. So they accredit the hospitals. with the hospital having Joint Commission accreditation, there's no questions asked on Medicaid services, which is Medi-Cal, Medicaid, ACA. If they carry this accreditation, then they get reimbursed, no questions asked, on studies or patient care that they provide. So hospitals have typically Joint Commission accreditation. Now, our educational facilities for radiologic technology have what's called hold on, JRCERT. So that's funny because that's put in there backwards. So the Joint Commission in Education and Radiologic Technology, JCERT. So JCERT is who accredits us. With our accreditation of JCERT, then what happens is they can go and they can sit for the national exam for your ARRT with no questions asked for RT programs. They also have MRI accreditation, so it's pretty new and not many know about it. We have also our college accreditation, which is ABHES, and ABHES allows you to sit for your national exam with ART, no questions asked. So this is an additional accreditation just for radiologic technology to show that we are of the highest of quality that we could offer. All right, so that is your Healthcare Delivery System Chapter 4. There'll be a quiz also, so make sure you review the PowerPoint, you read your book, because there's a lot more in the book and a lot more detail about all of this. Okay.